Thank you for joining my presentation regarding my capstone experience and project. This is intended for OT students and other professionals interested in promoting trauma responsiveness in school systems. We will explore important questions such as how trauma responsiveness can be applied in a special school network, and what are the implications for potential expansion to public schools or member districts. This will also include a description of how content learned throughout my time in the OT program has been adapted, refined, and integrated back into the education of current and future OT students at WashU OT. A little bit about my experience as a WashU OT student. I have always had a passion for promoting increased dialogue around mental health and emotional well-being. And I especially saw the potential for this lens to be applied in school systems and learning environments. And that's based on my own experience as a primary and secondary student in my youth, and during my roles and subsequent observations in specialized schools. And this is apart from my role as a fieldwork student and capstone student. In fact, my time spent as a paraprofessional prior to entering the OT program largely shaped my desire to emphasize teacher or staff training in schools as a mediating factor for student engagement and success. My prior experience with crisis prevention and de-escalation as a paraprofessional revealed to me reoccurring incidents and potential for re-traumatization among students. And this was largely driven by the nature of compliance-based environments or more traditional approaches to what is currently termed behavior management. And so my Level 2B fieldwork rotation at Belleville Area Special Services Cooperative, or BASC, lent itself really well to my professional interests and aims. Building off from fieldwork projects with my site mender allowed me to target these interests and expand upon them during my capstone. This required a mutual understanding, respect, and interests among my selected mentors and collaborators, and a space to learn, ask questions, and grow together as professionals. My fieldwork rotation allowed me to see the gaps and where information was being lost or miscommunicated among staff or between staff and students. This resulted in the question, how do we reach a larger staff audience, and how do we educate staff beyond those I've worked with during my fieldwork rotation? Efforts in these trial classrooms can be lost if the opportunity does not avail itself to all staff members who want to learn more. The trauma responsive lens was crafted when implementing my fieldwork projects. And it became clearer as I wrapped up my fieldwork that there is a deeper level to trauma responsiveness, and that includes classroom-wide and programmatic-wide paradigm shifts. And it became clear that this is something that is needed, valued, and desired by BASC organization staff. And it was also confirmed by data collected during another student's capstone project in the fall of 2021. I worked with two organizations, BASC in Belleville, Illinois, and the Washington University in St. Louis program in occupational therapy, or WashU. BASC is a specialized school network, as mentioned before, that serves students with varying disabilities across 23 school districts. OT consultation was utilized to address site-specific needs regarding accessible virtual educator training, actionable steps for increased family engagement, and recommendations for sustainable trauma-responsive program design. I also saw opportunities for a classroom-wide system of checking in with oneself and each other based on the adapted interoceptive curriculum that my fieldwork mentor and I trialed at the time in fall 2021. I also met with Jesse Bricker and Wanda Mahoney to discuss how I can spend my time outside of ESY or extended school year observations done at BASC. And so this is when we added the additional Capstone site of WashU OT, and my virtual collaboration with additional faculty such as Catherine Hoyt enabled the infusion of trauma-responsive principles back into the current course content and development of a diverse client case example. The overarching goal is to demonstrate the potential benefits of continuously welcoming and embedding acquired knowledge of the Capstone student into the current OT course content development. To make sure there was enough time to target all of my proposed goals, I requested an early start date for my overall Capstone project. Most OT students in my cohort began their Capstone project on May 16, 2022, whereas I began on April 28th. This early start date was critical in collecting the most up-to-date feedback regarding the student and faculty experience across select BASS schools, both during the regular school year from April 28th to May 19th, and the extended school year from June 13th to July 14th. Over the course of 16 weeks, I conducted virtual meetings with Basque and WashU OT site mentors to target objectives. Learning activities were supplemented by meetings with other course instructors, faculty, and related service providers at Basque, such as social workers. I utilized Zoom and Google Meet in addition to email and text messages to maintain communication with mentors and other key stakeholders. To inform programmatic and school-wide recommendations, a virtual professional development unit, or PDU, education opportunity was developed in a shared Google Drive folder to meet the pre-established needs of trauma-specific training among Basque staff. Participation in this training module provided insight into staff perspectives on virtual training opportunities and trauma-specific teaching and education approaches. Classroom observations, paired with interviews across educators, related service providers, and administrators, provided a glimpse into the strengths and challenges of current Basque programs and schools. Themes were pulled from these data collection methods and synthesized into a tool set, such as one-pagers, protocols, and a concept map, to be used as a component of continual program quality assurance. In addition, regular weekly meetings were held with WashU OT faculty to plan and develop case-based learning, or CBL, course content. To refine my skill set as an OT course content developer, I analyzed previous course content and materials, contributed to case development and exam materials, and collected student feedback regarding current and future learning topics. My main professional goals were to integrate my Level 2B fieldwork experience into my Capstone project, to expand on interventions established, including educator development, and developing effective educational modules for current WashU OT students regarding intersectional and trauma-responsive pediatric client care. And with these two aims, my overall purpose was to promote adoption of a school-wide or class-wide trauma-responsive lens at both sites. In terms of future careers, I've looked into curriculum and program development roles, Director of Education for nonprofits, Director of Education for GLSEN or other LGBTQIA+ focused networks, Director of Interprofessional Collaboration and Staff Development, Teaching Consultant, Director of Family Engagement for a school district, and so on. Due to my role as part-time educator at an early childhood center over the past 3 years, I have also looked into assistant head of school at Montessori Guidepost and have brainstormed implementing an adapted interoception curriculum beginning at a younger student age. In addition, I'm interested in altering education policy and advocating for education redesign. Similar to how social emotional learning curriculums and physical education hours are required, I recommend making an interoception curriculum and trauma-responsive design a legal requirement for schools to follow mental health responsiveness. and all while providing avenues for adaptation as needed to make it as unique and meaningful as possible for each school. Throughout the description of this project, I hope that I have demonstrated the benefits of engaging in both interprofessional collaboration and intra-professional collaboration to inform development of program resources, content, and recommendations during my capstone project. The overarching goal of this capstone project was to infuse trauma-responsive principles into education and instruction design for both specialized school networks and occupational therapy education programs like WashU OT. Again, this goal was addressed through the development of training modules for educators, support staff, and related service providers. And these approaches were intended to be continuously updated and applied in the classroom and therapeutic settings within the Basque Education Network. I aim to inspire a systematic paradigm shift through the work that I've done during my capstone toward changing Basque's approach to interactions with students. Ongoing opportunities for student-faculty collaboration within an OT education program can be used to reintegrate principles of trauma responsiveness and mental health into the current OT education curriculum. A few takeaways that I've gathered from this overall capstone experience was that my project would have been even better if I surveyed OT students prior to enduring my course content development with WashU OT and embedded those feedback methods throughout the process of content development, such as when I was preparing the MEQ case and the CBL case. At Basque, my project would be even better if I had met with administrators more often and conducted more interviews, particularly inquiring about the administrative perspective and incentive to engage in the PDU opportunity that I had created, and also investigating user access issues and general navigation of Google Drive or technology-based learning opportunities. Thank you for joining me during this presentation. Please feel free to reach out if you are interested in trauma-responsive education design and want to learn more or wish to collaborate with me at any time. You can reach me via email at burnsbc@boostle.edu.